Siamo a Leverkusen, in Germania, nella storica sede di Bayer, dove proprio oggi, di fronte alla stampa specializzata di tutto il mondo, sono stati presentati i dati economici del 2018 e le prospettive per il 2019 e gli anni a venire. Noi ci siamo fatti raccontare da Stefan Oelrich cosa sta succedendo nel settore farmaceutico, in quello dei farmaci da prescrizione, appunto facendo una panoramica del presente e soprattutto anche del futuro. Dr. Oelrich, could you please give us a brief description of how 2018 performed in the pharma prescription business division?
So 2018 for us was a good year overall. We showed some growth. We also had some challenges that were linked to some supply chain challenges at the beginning of the year, which had some impact on our overall results. But then again, also very positive, our growth, especially with the products that you know very well, like Xarelto or Eylea, which also in Italy are very important products. And launches. We launched Jivi, which is a new treatment for hemophiliacs in hemophilia type A. And we also introduced with larotrectinib under the brand name Vitrakvi in the United States, a new oncology treatment that is going to be very important as a precision medicine medicine.
How do you see 2019? Which is the forecast?
So we see for 2019 continued growth with Bayer Pharma. We're forecasted to grow about 4% for the year, which gives an incredible track record to our business, because we have now basically been growing over 10 plus years constantly at or above market pace, and we see this continue this year.
You said during your presentation that Bayer has more than 50 projects in the pipeline, but the jewels, the most important one, are three: larotrectinib that you already mentioned, darolutamide, and finerenone. Could you please give us a free spot regarding the prospects of these three products?
Yeah, let me start with our two latest oncology medicines. So larotrectinib, we have a product that is treating an anomaly that about 1% of people that have cancer have, which is called an NTRK fusion. So if you give a product, regardless of the tumor type, you can actually almost see, as some have reported anecdotally, melt the tumor away. So you fix this anomaly and the tumor goes away, if it's not too advanced, of course. That's larotrectinib, which we're also introducing in Europe this year. So I hope it will come to Italy, and I've heard that we already have, prior to getting our license in Italy, one patient that was diagnosed actually in the womb. So a pregnant woman that was bearing a child was diagnosed that she would have that anomaly, so the child could be treated from birth with this novel precision medicine. And then darolutamide is a product that we're bringing to patients that have non-metastasized prostate cancer. We have here very attractive results from our pivotal trials, which not only show strong efficacy, but also extremely good tolerability compared to anything that has been studied so far. And we believe that this is going to make a big difference to patients, because most of these patients still live a very normal life when they're diagnosed with this type of prostate cancer. And if you have a superb tolerability, you can just continue under treatment with this life. And then finerenone, last but not least, is our latest addition in our cardiovascular portfolio, where we aim to treat patients that have a decaying renal function. There's a very low therapeutic standard today, so big unmet need, both in diabetic population, which is a big part of this, so diabetic kidney disease, but also people like hypertensives and other cardiovascular patients.
So far, Bayer is not sitting at the table of CAR T-cell, cellular therapy, gene editing, and so on. How do you see the future of your company in terms of innovation? Also, because in the next 5 years, you will have to counteract a patent cliff.
So we have made a number of strategic investments in companies that are very active in the space of both stem cell therapies but also gene editing therapies. Those companies will have first products go into man, for example, in the case of our partnership with a company like BlueRock, which will have their first clinical trials start this year for the treatment and hopefully cure of Parkinson through induced pluripotent stem cell treatment. Same holds true over the next few years with our partnership in CRISPR-Cas with the company called Casibia, that in multiple indications is aiming to go into clinical trials very soon. So I feel that we're really in a very, very good position when it comes to that. Add to that we've just initiated phase 2 trials of our first gene therapy that we developed together with Unicure in hemophilia patients. So by end of this year, we should have some first results, whether that works or not too. So I feel we're quite advanced in that area, which gives me confidence that we're going to also be successful once that some of our current products go off patent.